Then can you talk a bit about letters of recommendation? You expect some letters from US rotations and all. What do you look for in the letters?
Yeah, so I think I've went over this before, but I think this is an important topic, right? So there's like kind of like a tiered system, and everybody will view letters of recommendations differently, guys. It's a very subjective interpretation, but I'll tell you as a program director how I personally view it, right? So I tier them with my team. So the lowest tier letter that you can get is probably from a non-US physician somewhere where you're practicing, right? So an international letter, right, vouching for you, and that's good. But the problem is, you're trying to apply for residency here, so you want a doctor that's in the US system that's vouching for you, that says you're good, right, and you function well in the system. So the lowest tier letter is an international letter. The higher letter would be a US physician somewhere in the community that's not academically involved. So let's say Poam set you up with a rotation somewhere in like Wisconsin, for example, with a doctor that's functioning in the outpatient setting. He has no connection to residency. He doesn't teach medical students. He doesn't teach residents. So he's still a board certified physician. So a letter from him is good, but a better letter would be if you went to like a residency program, right? Or for example, if you're rotated with program directors, faculty members, or chairs of departments. Those letters mean more, especially in the subspecialty of what you're applying for, because those people who are academically involved, like they know what the residents' expectations are. They train them, and so when they see somebody like you, they're like, okay, this guy can do well in the residency program. I'm going to write him a strong letter of recommendation. Does that make sense? So,
yep.
So in order to be competitive, guys, now you really want to get strong letters of recommendations from strong faculty or program directors or chairs of departments that can connect you. And obviously it's better because if they see my name, for example, or Simka's name, they may recognize us, like we're people that may have met them at conferences. They may call us directly and ask about you. That happens all the time. And that way that you get more connections.